It is October. Well, even though the month is far gone now, the pink month it is, and a time the world unites against cancer.
I can see the choice of your attire this morning.
Deliberate.
Yes, indeed, Victor. From awareness to action. This season is a reminder that early detection can save lives.
And here in Nigeria, conversations are growing around equity in cancer care, making sure that no one is left behind, no matter where they live.
And that's our focus today, equity in cancer care, a new era for Nigeria. We'll hear from experts on how far we have come and what more needs to be done.
And in the second part, we turn to politics. The Senate has confirmed Professor Joash Amukwito, Senior Advocate of Nigeria, as the INEC chairman. What should Nigerians expect? Well, we'll find out as the program gets going. I'm Victor Azo, and this is Good Morning Nigeria.
Indeed. I also welcome you to the program. I'm Ian Ray John. We're reaching you live on the network service of the NTA, and we're right here at our headquarters in Abuja. All right, you're still watching Good Morning Nigeria live on the network service of the NTA. And before we begin our conversation this morning, which is on equity for all in cancer care, let's quickly take a look at this background report put together by our correspondent, Ibrahim Dan Hamidu.
Every October, the world shines a light on cancer awareness. In Nigeria, this month is a reminder that awareness must lead to action, especially when it comes to making care fair and available to every citizen, wherever they live. This year, with International Cancer Week running from October 13 to 17, the focus is equity. Did the federal government's recent disbursements to states translate into more screening, better diagnosis, and affordable treatment for the poor and the rural? Or are services still concentrated in a few urban centers? Chairperson Chioma Uzodimma says FLAC has reached more than 625,000 women with prevention education, led screening drives reaching thousands, and provided free breast and cervical screenings across states. But more is needed. Uzodimma warned that many Nigerians are still present with late-stage disease due to poor access to early detection. Each number is a life deferred or destroyed, she said, urging a rethink of women's health priorities in line with the National Cancer Control Plan 2023 to 2027. FLAC also stresses that up to 40% of cancers are preventable through lifestyle changes, a message the group reinforces alongside partnerships with the World Health Organization, Clinton Health Access Initiative, Roche, and UICC. The Minister of State for Health, Dr. Adekunle Salako, has called for strengthened cancer surveillance and a data-driven approach to policy. He described cancer registries as the heartbeat of evidence-based control and said the federal government is prioritizing digital transformation, data integration, and stronger national registry networks to ensure no community is left behind. Director General of NICRAT, Professor Usman Aliyu, highlights ongoing efforts to build new population-based registries, train registry staff, and align Nigeria with global best practices. Partners like NORA and AFRCRN are supporting capacity building and regional collaboration, but experts say equity will only come with sustained funding, state-level policy adoption, and local access to screening and treatment. As Nigeria marks Cancer Awareness Month and highlights International Cancer Week, the central message is simple. Awareness without affordable and accessible services is not enough. Equity demands that diagnosis, treatment, and survivor support be within reach for rural communities, the poor, and marginalized groups. Today on Good Morning Nigeria, our guests, experts in cancer, will discuss practical strategies to deliver equity for all in cancer care, how to turn federal disbursements into local action, scale up screening in the state health systems, and build a national system where early detection and treatment are a right. not a privilege.
It's a system where early detection becomes a right and not a privilege. Many thanks, Ibrahim Habidu, for that background report. And now joining us to discuss equity for all in cancer care. Let me make welcome here in the studio Professor Abubakar Mohammed Bello. He is the President, Association of Radiation and Clinical Oncologists in Nigeria. Thank you very much for joining us again.
Thank you for having me. It's always a pleasure to be here to talk about something that affects literally each and every one of us, which is cancer. Always a pleasure.
All right, many thanks, Prof. Also here joining us for the conversation is Dr. Usman Waziri, Director, Cancer Prevention and Control at the National Institute for Cancer Research and Treatment. Many thanks for joining us, sir.
Thank you for having me. It's a pleasure to be here.
All right. Thank you. Welcome, gentlemen. Let's begin with Professor Mohammed. Let's look at the big picture. When we talk about equity in cancer care, what really does it mean in the Nigerian context?
So when you talk about equity, basically, you want to see that every cancer patient is taken care of, regardless of where he comes from or his financial background. So that's the equity in cancer care. In Nigeria specifically, you do know that we have so many new cancer cases, about 120,000 every year, and out of which over 70,000 die within the first 1 year, which means that a lot of them are not accessing care for so many reasons, some financial reasons, some where they stay, and so on and so forth. There are a lot of improvement, towards equity in cancer care in Nigeria. Over the last couple of years, we have been able to have more. We had only like 2 centers 10, 15 years ago. Now we have about 10 cancer centers in the country, and access even to experts like clinical oncologists, where I have the honor to lead, the clinical and the radiation oncologists in this country was so few. Now we have over 150 with about 100 active within the country. So there is a lot of things that are developing. And even government is really showing a lot of renewed commitment toward, enhancing cancer care around the country. They are putting so many things in place, like supporting indigent patients with the Cancer Health Fund, and so on and so forth. Now, having said that, we do know that there are a lot of challenges as well, towards equity. The cancer centers primarily are located maybe in the southern zone as compared to the northern zone. Even the expertise are primarily in a particular region, is not spreading completely around the country. And training also is such a very big, important thing. So in our organization, we have tried to identify how do we close the gap, in terms of equity. And we have looked at about 4 different pillars. Number 1 is professional expertise. We want to make sure that every oncologist, wherever you are practicing, you are doing the best clinical practice, best global practice. And we are also encouraging continued education of the professionals. The oncologists are properly trained all the time. And we have also looked at infrastructure and access. We want to encourage the government. We've been, involving government in so many ways to see that new centers are created around the country. I'm happy to note that in the last 2 years, about 3 new centers or 4 actually have been created, and those that have been there in the past have also been supported. If you look at Enugu, you look at Benin, they have been there, but there were no machines and so on. Now they have radiotherapy machines, so they are doing a lot better than they used to be. So there are many things that have been done. towards closing the gap in terms of equity.
Equity. I thought you would also mention when you talked about equity, because for me, for most people, equity for all in cancer care, you want to talk about the fact that maybe there's more attention on a particular cancer than some others in the country. Is that also a challenge?
Yeah, so there are so many, like I mentioned earlier, that there are so many problems surrounding cancer care, and I was talking about the pillars that we have mentioned. We're talking of infrastructure, we're talking of access. So there are, of course, cancers that are more prevalent than others. So if we are able to reduce, take for instance, in females, if we are able to reduce the prevalence or to make early detection of two cancers only, cervical cancer and breast cancer, you would have been reducing the prevalence by almost 50%. So that is very critical. And in male, if you are able to reduce the prevalence of prostate cancer, for example, you would be able to reduce the burden of cancers in this country by about 35%. So that's significant.
Okay, many thanks. Dr. Waziri, let's get to you now. Prof has laid a beautiful background for us, for the conversation. Speak to us about what NICRAT is doing. We've had you a couple of times come on the show to talk about, the efforts being made by government and your organization. But as of today, are there more improvements?
Well, quite sure. Let me say, in terms of equity question, just as Prof rightly highlighted it, ensuring equitable access to care regardless of socio-economic background. And in that regard, I think quite a lot has actually happened from the time we were here till date. For example, in the area of ensuring deployment of services, cancer, across the spectrum of cancer care, right from prevention through to early detection, treatment, as well as palliative care. I think government has invested hugely in that area. The current administration, I think, for the first time, we are able to deploy. There was a capacity building regarding basic cancer prevention services, early detection, to improved outcome of treatment. And this was done last year across the 6 geopolitical zone on a pilot scale. And this year, there is a plan to improve that. The essence is there is an initiative that is being championed, an initiative of government, the current administration that has been championed through the agency, the National Initiative for Cancer Early Detection, Screening and Coordinated Access to Care. And this is actually aimed at deploying cancer care services, more especially in the area of prevention, awareness creation, as well as screening, with focus on cervical cancer and breast cancer, as rightly highlighted by Prof. By the time we are able to address the menace of prostate, breast and cervical cancer among Nigerian women, we've gone a long way in drastically reducing the burden of morbidity and mortality among Nigerian women. So in that regard, breast and cervical cancer, the Nigerian government, through the institute, has already constituted the National Task Force on Cervical Cancer Elimination. This is aimed at operationalizing the prevention, vaccination, preventive services, as well as early detection. The good thing about cervical cancer is you can detect it early, the precancerous stage. So part of the initiative is to ensure that those with precancerous stage have access to treatment and are treated effectively. Already, stakeholders engagement, mapping has already been concluded. November 17, the activities, the program will commenced. We will launch the program within southeastern region. So in that regard, that is driving access, equitable access, ensuring that the hitherto less underserved population of the country are actually covered and are provided with access to services. And that is not alone. There is effort, as I mentioned earlier, coordinated access to networked care. Why that is there, the government looked at it to address the gaps in terms of facilities, the gaps in terms of personnel. There has to be an effort to coordinate and link this screening. It makes no sense when you screen a woman or a man with cervical for cancer and you cannot link him up with treatment. So the part of the program is ensuring that whoever got screened at these facilities for the first time, by the end of by November this year, the government will be launching 8 federal institutions, facilities, institutions with that are equipped with facilities to do high-tech screening for cancer, with focus on 5 common cancers in the country. These are breast, prostate, cervical, liver, and colorectal cancers. So these centers will now serve as hubs where patients from whatever background can be linked to and get access to care. And it's still in part of ensuring equitable access. When you deploy services, the next thing is affordability of care. As rightly highlighted by Prof, this government, through the agency, is working tirelessly in ensuring that we improve National Cancer Health Fund. Cancer Health Fund has been in existence in this country since around 2021, 2022, but with the coming of this government, efforts have been on ground to ensure that we've expanded the services, just as you said, in terms of coverage and in terms of facility centers that are under this National Cancer Health Fund. And the primary essence of that is to ensure that the underserved, the less privileged, looking at the cost of care, have access to support for purchase of care. And with that, we'll ensure that as we are screening, numbers are increasing, the government is making effort to expand this. Already, there has never been a budget line for childhood cancers. In this 2025 budget, government has dedicated a budget line domiciled at the agency to support children with cancers, because for quite some time, these are areas that have been neglected. So when we talk of equity for care, you see, it's not only limited to the socio-economic background, even the age. For quite some time, children with cancers, people have not been talking much about them. As a pediatrician, I know a lot of children are living with cancer that are not only preventable, can be detected early, and has higher potential for cure. So
but how soon all of this, I know the Sinker initiative is also there.
Yes.
How soon, or if that isn't already happening, will we begin to see impact at the patient level?
Yes, this is quite a very good question. Impact at the patient level. Already we've worked on the modalities and strategy for implementation. We have been in touch with local and international partners like St. Jude Global and Nigerian Society of Pediatric Oncologists. We've already engaged and mapped centers based on certain strategy and criteria, facilities-wise, expertise, and we've already identified that, and we've already developed modalities, and in the next couple of weeks, we are launching the commencement of childhood cancer fund support for children living with cancer. So by the end of this year, I'm sure a lot of Nigerian children will start benefiting from that. So okay. I think practically we are talking about that. In terms of Sinker that you've mentioned, already Nigerian government in this current dispensation through the institute has already trained over 200 Nigerian young researchers, oncologists, scientists in the area of cancer field for high-tech research that is not only reflective of the scientific progress, but the lived reality of Nigerian patients, to see how we can base our policy formulation, our practice in the area of oncology to address Nigerian cancer challenges.
But let me take that to Prof, because one issue we still do have is uneven access between the urban and rural areas. In your opinion, what single policy could be that game changer to close the gap?
So, you see, there are different levels of cancer care. When you start talking about prevention, for example, that should spread all over. Waziri was talking about cervical cancer, which is actually a preventable disease. You don't even have to allow it to even develop to precancerous condition, because there is a vaccine, right? And there is a vaccine that you can actually use for young people to be able to prevent that cervical cancer from developing in the first instance. And Nigeria actually has keyed in into the global initiative of the 1970-90 of the World Health Organization, where it's expected that about 90% of children would be immunized, with the human papillomavirus vaccine. And Nigeria has done so well. So far, we have been able to immunize about 50 million, children in this country within the last 2-3 years, which is so fantastic.
And vaccination is still ongoing at the moment.
Sorry?
At the moment, is the HPV
So it's an
vaccination.
ongoing thing. It's not like it's a one-time thing. It's a continuous process. But Nigeria has successfully been able to vaccinate this number, which is fantastic. And with the fact that now we know that one dose of the vaccine is sufficient, as compared to previously we thought it was 3, then it became 2, and now studies have shown that even 1 is enough to prevent children from contacting the human papillomavirus and developing cervical cancer. So that is one area that is low-hanging fruit, okay? But the area that is really, really quite difficult now to have is that we have equal spread of cancer centers across the country. And I want to believe, for me, is that federal government alone cannot do it. State governments must key in to be able to provide cancer centers, because it's doable. States should be able to provide. There are about 28 states in Nigeria that have no presence of any cancer institution or comprehensive cancer centers, as it were. There are no radiotherapy equipment, basically. So, and that is huge. So that means patients from rural areas need to travel to urban areas to access care. Sometimes they can't even afford to go there, and even when they get there, the cost of the treatment is prohibiting, and so on and so forth. So these are very important things. But Nigeria has developed the National Cancer Control Plan, where there are, clearly defined stages of how to close this gap, in terms of screening, in terms of treatment, in terms of prevention, in terms of palliative care. And it has been costed many years ago. But unfortunately, there is no funding, there is no backing, financial backing to be able to implement this. In this country, it has not yet been institutionalized to have screening, for example, nationally for cervical cancer. So most of the cervical cancer screening are being done individually and by NGOs that encourage cervical cancer. So it's not institutionalized, it's not a must. But it should be a must that women should go for cervical cancer screening, because this is of national importance, right? Because patients that develop cervical cancer have so much, not only disease implication, but also economic and so on and so forth.
But the cost of screening is also a challenge for a lot of women.
And that is why the National Cancer Control Plan has developed templates where they can crash down the cost if implemented by government. It will crash it. Take, for instance, the human papillomavirus vaccine. Until it is now implemented, it was so expensive. But now government has taken the fight and have provided all the necessary vaccines across the country. And because of that, people are keen in. So the same thing can happen even to screening of cervical cancer. The same thing can happen to screening of prostate cancer. The same thing can happen to screening of mammogram.
What about professionals, in this field? I'm talking about people like you. You talked about 100. Is that sufficient?
Not really. It's really grossly inadequate. But that is the story of sub-Saharan Africa, really. And even the ones that were training are now JAPA. I learned that JAPA now is an English word. It's in the dictionary, so I can comfortably say the JAPA, So that is one of the key areas. But we have, as organization, have looked at areas where we need to work quickly. And one of it is to make sure that we engage government to provide more training, more doctors to become specialists in cancer care. And that is one of the things that we are doing. But it is so small, it is so meager. Every oncologist now in this country is taking care of 2 million people when you are supposed to be taking care of less than 100,000. So you can do the math. So everyone has a burnout syndrome, and most of them have acute fatigue syndrome. The last time one of my younger residents actually collapsed in the hospital because of overwork. There are not enough.
Not enough. What about infrastructure?
Here, so that we remind the viewer to send in their messages. Of course, emphasis on short messages. The number is on your screen, just so that we can take a number of them as the conversation progresses.
All right. Being an expert in the field, what would you want to say? What areas should government focus on in terms of infrastructure that can help you get the job done better and faster?
So infrastructure will not only entail providing equipment, it should provide training as well, because machines don't treat patients. It's the human that train. So human development should be the number one thing. And that is why we have gone to make sure that there is an established training faculty in the National Postgraduate Medical College, as well as the West African College of Surgeons, that are primarily training oncologists like us, that are using radiation therapy, chemotherapy, targeted therapy for the treatment of cancer. And we don't only do that, we do advocacy, we do so many other things, engage policymakers to make sure that these things are institutionalized. So that is the first most important thing. Because when you talk of infrastructure, generally you are thinking of providing machines, radiotherapy equipment across the country. Where are the people that will man those machines? And how trained are they to provide those services? So these are the most important to my mind. And in fact, for our organization, for our association, what we think is the low-hanging fruit is to train people, more training in oncology departments. If you go to most of the centers now, you'll be surprised that there are very few residents. So as a professor of oncology, I still do the same thing that I have done 20 years ago. Sometimes I clerk patients because simply there is no one to do it. And I work with only one resident most of the time, when I should have about 10, 20 so that they will learn what I have learned over the years. But simply the doctors are not there, and government should make concerted effort to employ more.
When you talk about the professionals, is it just the doctors? What about the technologists, the technicians, those who deal with the machines you're talking about, yes, right?
So I'm talking, from up and down. So I'm going to come down. The position of leadership always is with the doctors. So that is why I'm concentrating, and that's the association I'm representing. But suffice to say, you're absolutely right. You're absolutely right that it's not only technicians. In fact, there are a lot, support staff. Support staff is very critical, and they are dwindling. About 3 of my medical physicists at the National Hospital just walked away about a month ago and got another job in the UK.
They didn't walk away, they flew away.
Well,
all right.
There's so many words that can be used
let's
to tell
talk
them.
about...
And one individual now is supposed to continue their job. And there is no replacement, and nobody is even talking about it. Nobody is talking about it. How do we replace these people? And the work keeps piling up. And he had to go for a training in South Africa, and we had to keep some of the treatments until he comes back, because there was nobody else to do it for them.
But replacement naturally will come from the universities. I don't think there's anywhere else to get replacements from.
Excellent.
You train more, you keep
excellent.
training.
So
and they are training, right?
So excellent. Yes, there are training, but they are not enough. And a lot of them are not being employed. And that is why we are talking of government making concerted effort. Okay. We must make concerted effort to train. We must make concerted effort to employ. Okay. If you train and you are not employing, then it's as good as you are not doing anything.
All right. Dr. Waziri, let's talk awareness, which remains a challenge, I mean, especially among low-income communities. So how can traditional and the social media be deployed to drive early detection and support systems more effectively?
Yes. Awareness creation and public education, generally regarding in the areas of health and specifically cancer, is really very strategic in terms of raising and improving people's perception and attitude towards the disease. And in that regard, our government is doing a lot, and there's still more room for improvement. Like currently, we have a plan, a costed plan, funded by government, about to be rolled out. Also, in the area of multi-pronged approach to awareness creation. And I mean through community sensitization and community engagement, branding of traditional and community influencers, traditional rulers, religious leaders, as well as community-based organization leaderships as ambassadors to create more awareness and informed and influenced decisions and thinking of the people at the grassroots regarding cancer. Then the social media also, as well as digital platforms, we've engaged quite a number of consultancy firms, and the government is doing every effort to ensure that that has really been kickstarted. Then, so also in the area of government agencies also, we have developed a robust plan, a sort of partnership and collaborative plan, strategy to engage sister government agencies like the NTA, the National Orientation Agencies, in the area of awareness creation. And we're equally utilizing school institutions like schools and National Youth Service Corps to really raise that awareness regarding cancer care, cancer itself, to demystify. A lot of information, communication, and education materials have been developed by the Institute, and we've shared them in 2024, and we are still distributing them. The second batch of distribution will commence, and we are targeting institutions like hospitals, where you have patients and people coming for care, schools, more especially secondary schools, as well as primary schools, and then tertiary institutions also. Then, market women organizations, we are using them. Farmers, we've had a pilot community-based engagement in Plateau States, in Kebbi State, in the north, and then in Ogun State, and in River State in the south, trying to form a model, developed a model, a form of communication strategy development that will develop community communication, cancer communication to the community. The findings and learnings from that, we use it to build upon what we are planning to roll out very soon.
But what about collaboration? Since you are talking collaboration for awareness, what about for cancer care? Collaborating with the NGOs, with private sector, to ensure that cancer care becomes more affordable and sustainable?
Yes. You know, we've initially discussed about awareness. In the area of care, cancer care, and this is one area that since the coming of the Institute, the government, through the Institute, has really been making a lot of efforts. Let's take, for example, the issue of policies and the issue of cancer control plan that was highlighted by Prof. When the Institute came on board, we realized that the National Cancer Control Plan need to be reviewed. The Institute reviewed it and developed the National Strategic Plan for Cancer Control in Nigeria in line with the WHO request or requirement, and that has actually been launched 2023 to 2027. Got costed, and we've already started implementing it. Part of the implementation plan, we have the strategy for cervical cancer elimination, operationalization. In the course of operationalizing it, the Institute has already formed a task force committee and create partnership for the elimination of cervical cancer in Nigeria, PESIN, which got launched sometimes. And I think this is a very giant stride towards operationalizing it. Still in the area of partnership, you know, you need to have a needs assessment to know where we are, and where we are going and to direct our activities. The Institute engaged international partnership, International Atomic Energy Agencies, World Health Organization, International Agency for Research in Cancer, and conduct a needs assessment, a sort of impact review in this country. That was concluded 2024. The report has just been launched and presented 2 days ago in the just concluded ICW. That, the essence is to create this partnership, a holistic approach, a bankable document that would now guide us. And through it now, we have established that partnership. The IAEA are there. Then locally also, we have local collaborators. And that is guiding us to know where we are now and where we will be by the 2027, 2028.
Okay.
And that is exactly the blueprint we are operating.
Brilliant. Many thanks, Dr. Waziri.
And in terms of costing, I just wanted to put it in. Quite sure government is doing a lot because most of these activities, this present dispensation, based on the findings from this impact review, from the needs assessment, from the collaboration, most of the activities, we secured budget line for research in cancer, we secured budget line for prevention and screening services. We are, for the first time, this government is establishing nationalized or government-owned, taking ownership of screening services in the country. 8 facilities in the country at tertiary level will serve as hubs for screening of common cancers. And then there are plans to build out capacity to partnership that is established at the subnational level to take that ownership and ensure sustainability.
All right. We hope that, all of this that you have said would actually translate to reality, in a short time. But, Prof, I'd like to get to you as regards awareness. He's talked about awareness on the part of the populace. What about awareness in terms of other medical practitioners, not oncologists this time? Because, most times we talk about cancer, you talk about the fact that they present at late stages, and that's also increasing the burden for treatment and all. But of course, we can deal with it or probably even prevent it if, when patients present at the hospital, the general practitioners who see them are able to refer them as early as possible. So there's also the lack of awareness on the part of medical personnel who are not oncologists. So what are you doing in that regard, just so that they are also skilled and trained to do the needful as early as possible?
Well, that's a very good observation. I must commend you for that, because we do know that from diagnosis to treatment takes about 3 to 7 to 1 year, 7 months to 1 year. And that is really one of the real reasons is that there is the differential of cancer is always at the backdrop of, clinicians when they are doing it. And having said that, government, not only government, even our organizations, we have participated in developing some cancer desk or some desk information that was supposed to be disseminated to secondary institutions as well as primary health care, because we believe that this should happen from primary health care. Primary health care is being strengthened, and they should be educated to recognize early symptoms of cancers. If we are able to do that, I know that government is working very hard to strengthen all the primary health care. They have put in so much money in the last 2 years. The Honorable Coordinating Minister of Health is an expert, and he has so much passion on primary health care, which should be the first step, when you are talking of health care, cancer care. So primary health care should be strengthened to be able to recognize, and that is the first way. And we must develop the referral process, where when somebody has index of suspicion, is able to send to the appropriate quarters. But it gets back to the fact that we do not have that prerequisite number of experts even to take care of those that have been referred. So there is that disconnect as well. And yes, there is continued medical education, not only for oncologists, but for general practitioners. We have been doing that. We have been doing webinars from our organization, from our association, to educate other doctors how to recognize early symptoms of cancers and to refer them to the appropriate quarters. You know, we are usually at the receiving end, because when you look at the chain of, the process of making a cancer diagnosis, before it gets to the oncologist, who is the last person on the chain, it takes several months. Now, you recognize that there is a symptom, you have a lump, somebody feels a lump on the breast, he's sent for mammography, the mammographer will do a mammography, and he will now send it for biopsy, and then the biopsy, will be, that biopsy specimen will be sent to a pathologist. How many pathologists do you have in the center, and how long will it take for him to make a diagnosis before they are now sent to the surgeon or sent to the oncologist, as the case may be. So it involves a lot of professionals. Okay, it involves a lot of professionals that we do not have at this point in this country. So that is why late presentation for the not so distant future will continue, even if we are making all these giant strides that Waziri is talking about. It will take a while before we will clearly see the impact of what is being done. But if we are able, importantly, we are able to domesticate our professionals, support our professionals so that they don't need to japa. They can stay here, because I tell you, if you are working abroad, it's not the same as staying here. Some of us have had that experience so many years ago, and we decided to stay. Not because we are being paid fantastically, but because it is important to be here.
What can be done to make the medical personnel stay? What should be done? Is it about salary alone, or
no,
there are other
certainly
factors?
not. Certainly not. Otherwise, a lot of us will not be here. But provide an environment that is rewarding to work with. If you are looking for this equipment, you get it. If you are looking for that equipment, to get. People that come back from abroad develop private practice, and they are happy doing it. Not because of all the money they are making, but because they have put things in place. There is that chain of referrals. There is that equipment that is readily available. There is that nurse that is willing immediately to support this patient. There is that medical physicist that is there to plan the patient. There is that therapy radiographer that is always on the ground to treat the patient, and so on and so forth. All these things, we must have a systemic change. We must do something that will change the narrative around, cancer care or around health system, that makes our professionals not to be just civil servants. Because what we have now is fundamentally civil servants. Everybody is in a hurry when it is 4 o'clock to leave, to go home, because he will miss the bus and he can't afford an Uber. So it goes round and round. The salary, there is no doubt about it. It is almost, how do I even put it? You see, 2 years ago, what I'm earning is 1/3 of what I'm earning today. So my salary when I was a house officer 37 years ago is more than what I'm earning today as a professor. Yes, when you turn it into dollar value. So this is where the problem is. We need to have an understanding. People complain they are japa, they this and that. How much money do they make there? But you see, and there is no, that's why I said it's easier to stay here. A little push from government, will make Nigerians to stay, because we love this country. Nigerians are the most proud people on earth. Anywhere you go, anywhere in the world, you see a Nigerian, he will be proud to say, I'm a Nigerian. Anywhere. But there are certain things that we must put in place. And some of it is around not only around salary, but making the system work. Our health system needs to be looked at. And that is why we're developing next year, hopefully, we are doing a national oncology summit where we'll invite stakeholders, we'll invite government, we'll invite partners, the IAEA. They have programs that we have not keyed into as a country, you see, where we can get support. There are so many of them.
So if
and
you have
we're not
to,
talking about
if you have to, Prof, identify one priority that could define Nigeria's cancer response in the next 5 years, for the next 5 years rather, what would it be? We're running out of time.
Let us develop comprehensive cancer centers, one at a time, which we do not have. What we have today is cancer departments in teaching hospitals. It is not the same. We should have comprehensive cancer, stand-alone comprehensive cancer hospitals, where when you walk in, you said, I felt a lump, it will be done within a week.
And that
everything
aligns,
is be put in place.
And that aligns with the message that we got here from Fram. He says he's from Lugbe in Abuja. He says, good morning. Regarding this morning's conversation on cancer, we have a cancer center in Lugbe, Airport Road, that has been locked for years. I think the government should make that place a center for cancer research and treatment for the people.
It's not
I think
for
it
the
will
government,
place a mark of excellence for President Tinubu's renewed hope agenda.
It says it's not a government facility.
It's not a government facility.
It's not?
Yes.
But I thought it was established by government.
What are the reasons you think it's grounded?
Well, it has never. It's a long story.
It's
We
never
are part
taken
of it,
off.
but it has never. Yeah, it has
It
never
never
taken
worked.
off. It's a private enterprise.
All right. So
I thought the first lady, the late first lady, had a hand in it, to help.
Late.
Yes,
She's
former.
not late. Former.
Former late.
Yes. It's a long story, really. We are part of it, but the long and short of it is that it's not a government facility.
Oh.
But I think that there are people that are interested in that facility, and hopefully very soon it will come to.
All right, let's take some more questions now. This one is from Ahmed Baba Dikwa from Maiduguri, and it reads, to empower the public in the fight against cancer, stakeholders from health ministries to tech innovators must pioneer a simplified cancer surveillance system. This means moving beyond complex medical terms to create clear, accessible tools and guidelines. Another
We
one
agree.
says,
I agree with him totally, and honestly, we've been doing it. You see, Nigeria is 220 million people. It's not like Rwanda. When people talk that Rwanda is doing this fantastic, they are just 14 million. You see, so that is like Kano.
Okay, let's talk about India.
Yes.
India is also doing it.
Yeah, but India took a lot of years.
And India is 1.4 billion.
Yes. But there has been sustainability in whatever is being done. You see, every government will come and do one thing, and then after a while, another government comes and said, no, this one is not good enough. They change it and so on. Sustainability in health systems is what makes it
thrive.
So that is the challenge.
that
It's not
is
because we
one
are
of our
220
challenge.
million
Yes.
people.
So I'm coming to that. What I'm trying to say is this. You see, every government that comes puts in a lot of money. But whether that is sustained consistently is what makes the difference. I will tell you the story of India because I know. You see, when India, in the 70s, when Indians are scattered around the world, their health system was not such a fantastic thing. But they sat down and realized that, look, we need to put a lot of money in healthcare because healthcare can in itself be a business. So they decided to invite all their professionals within and outside the country and said, what is it that you need in terms of cardiology? Let's have hospitals that are specialists in cardiology. What are the things that we need in cancer care? Let's have hospitals. And they provided them with enabling environment, enabling policy, and even financial support. for them to be able to develop those hospitals. All the hospitals that our people go to in India are private.
And you know,
They don't go to government hospitals.
Nigeria can take a cue from that because we have professionals,
yes,
spread across different parts of the world. Fantastic. Let's read some more questions, from our viewers. This one says, there are more types of diseases that require government intervention, not only HIV and AIDS and tuberculosis, but also cancer, kidney disease, and other critical illnesses and conditions that the government is expected to manage through healthcare policies, funding, and public health programs. Now, this includes providing free treatment, palliative care, and financial support, as these diseases are highly prevalent in Nigerian communities and can lead to death if proper care is not available. Quite a long one from Chinda Gadsma. Thank you. Another one from Yusuf Abdul. Because of time, we cannot take it. I think we'll just take the final comments from Dr. Waziri as we wrap up this conversation.
Yes, I think quite a lot has actually been said, but let me start with the issue of the center alone, the airport road. Quite sure it's a private, it's not a government center, but I think one important thing that happened in the area of cancer care in the country is the establishment of an agency, the National Institute for Cancer Research and Treatment, in 2023. Quite sure a lot has actually been happening through silos activities with little or no coordination, but I think with the coming of the institute, a lot actually all these activities are now being streamlined, and government currently in the 2025 budget has already budgeted a significant amount for the takeoff of the establishment of a world-class cancer research and treatment facility in the country, to serve as the headquarters of the institute. That is in that regard. And then quite sure regarding workforce, this we've identified this, and the government has actually been doing a lot. Government was able in this current dispensation to brought together the institute, the Federal Ministry of Health, the National Nigerian Universities Commission, the Federal Ministry of Education last year, and we had a National Oncology Workforce Summit. And this was aimed at developing strategies to really bridge the gap when it comes to oncology workforce.
Many thanks, Dr. Waziri. Because of time, we'll have to leave the conversation at this point. Many thanks, Professor Abubakar Mohammed Bello, President of the Association of Radiation and Clinical Oncologists in Nigeria. It was a pleasure to have you. Thank you.
Thank you
and we hope that you continue to encourage medical practitioners to remain just the way you have. Thank you so much. Dr. Usman Waziri, Director, Cancer Prevention and Control at the National Institute for the Control of for Cancer Research and Treatment. Many thanks for being our guest. And yes, keep up the good work. We hope to see you some other time to hear all that your organization is doing.
Thank you. It's a pleasure.
So that's our first conversation. We have a second leg on the program this morning, and that's on the brand new INEC chairman. Please stay with us. All right, welcome back. It's still Good Morning Nigeria, live on the network service of the NTA. Yesterday, if you watched the Nigerian Television Authority, of course, you would have seen the Nigerian Senate confirming Professor Joash Ojo Amukpetan, SAN, as the new chairman of the Independent National Electoral Commission, INEC.
Well, a major development it is in Nigeria's electoral journey. And already expectations are running high.
Very high, I must say. As Professor Amukpetan takes the helm, many are watching to see how he'll tackle the challenges that have, ravaged, or if you like, dealt a very big blow on the commission through the years.
Organizing credible election is one, restoring public trust in the electoral process is another. It's a huge responsibility, I must say.
And so today we'll be exploring what Nigerians expect from the new INEC chairman, the priorities he should focus on, and how he can redefine electoral management in the country.
And joining us to share insights are Dr. Aminu Hayatu of the Department of Political Science, Bayero University, Kano. A pleasure to have you on Good Morning Nigeria.
Good morning. Thank you for having me.
All right. Also here for the conversation is Chief Ezenwa Nwagu, Chairman Partners for Electoral Reform and convener Say No Campaign Nigeria. He is also here for the conversation.
Thank you. Good morning. Good
All
to
right.
see you again.
Welcome, gentlemen. Let me begin with Dr. Hayatu. And of course, what do you think should be Professor Amukpiton's first line of action as he steps in as chair of INEC?
Okay, thank you. I think for me, most of the time I wonder even why it's an issue when we have a new INEC chairman on board to lead the electoral empire, and then it becomes an issue to say there should be something different. For me, the body is established by law, and anybody who finds himself to steer the affairs of that body should just walk by the law. So if we are really developing new expectations every time there is a new chairman on board, it means that many things are wrong when in the course of leading that organization. And I think this fundamentally raises the questions, about how well, the electoral empire actually, is being able to carry its responsibilities, under the leadership of the INEC chairman. And I think one of the expectations is that Nigerians are still not very confident in the way that some elections are conducted in this country. Because if you look at, post-electoral reactions, you see that from the courts of law, to sometimes even protest about the way certain elections have happened, and the general dissatisfaction. If you go to the media, you see people coming up to complain that, some elections are conducted not in accordance with the provision of the law. So the expectation of the new INEC chairman would be to really sit down, sit back and look at what has gone wrong before he joined the commission. If he doesn't get it right from the beginning, there are a lot of expectations from Nigerians as we are heading towards 2027 election. And already many Nigerians are of the opinion that the INEC is still a body that serves the party in power. Mm-hmm. So to be able to debunk that assumption would be to practically showcase to Nigerians how INEC can be a neutral body in conducting the elections. And even the question of capacity, because INEC is one of the few government bodies that are giving all that they ask for. You don't get to see them complaining about funds, about anything. Logistics are very important in elections. We've seen over time when elections are held, they are supposed to start in the morning, early in the morning, but some elections are held after 12 noon. And then before the time runs out, and then a lot of people are in the queue, they are not able to vote. Screening of voters is also a logistic problem that we still see. Look at the recent elections that were conducted in Rivers, and the reruns that were conducted in Kaduna and so on. People waited in the queue for a very long time without anybody coming to attend to them. We see pressmen going around interviewing people, and they're complaining that we didn't see the officials. And then when the officials are conducted, they say we are waiting for the arrival of the materials and so on.
Okay.
And so many of these things, really the new INEC chairman need to sit back and look at what has been the problem before he comes on board and how he can really plan to be able to begin to address
Many
this.
thanks, Dr. Hayatu, for your opening comments. Let's get to Chifumagwe now. We have worked with almost all the INEC chairmen so far. This is a new one. A lot of people are saying the litmus test for him is the November 8th election in Anambra. What do you expect?
There is no litmus test. I think part of the challenge that we have is that we like to build personality cults. We are not very much interested in being systemic, and so we celebrate individuals and then honor those who self-promote. Once people self-promote themselves, we're excited about that. And so that's why we are always interested in one man.
And it's coming from a military commandist background where we think that a leader is a commander. He can instruct. INEC has a chairman with 12 other national commissioners whose mode of appointment is the same with the way the chairman is appointed. Those 12 national commissioners are not his subordinates. They are also nominated, screened with the intervention of this Council of State. Now, these 12 national commissioners come from zones, representing zones with different, play. These people worship in different shrines, drink from different ponds. He is presiding over these 12 other people. Managing those 12 is the first critical assignment. How you are able to marry these varying interests that are represented politically in the commission. That's number one. Then you have 37 resident electoral commissioners who are also appointed in the same way the national chairman is appointed.
And wield significant influence.
And they are not his schoolboys. There will be mutual respect. These 37 resident electoral commissioners with quasi-independence to organize election in their states, with 37 administrative secretaries, with 774 electoral officers, and for a general election with over 1 million ad hoc
Staff,
including vice chancellors and other academics who function as returning officers. So when we build this personality cult, we give the impression that this chairman, and that's why Dr. his prefacing was important for me, that every time these appointments are made, there's a furor that comes with it. Oh, what are the new expectations? As if he's a major general that will simply now start. He has to navigate certain minefields. And organizing these minefields are important. He has to study the political environment. He has to understand the different stakeholders in the electoral pyramid.
But he doesn't have time to do all of this before Anambra.
Anambra work has finished in Anambra. He is not the one conducting Anambra election. There is a national commissioner in charge of Southeast. Okay? If there are 10 things to be done, 8 has already been done in Anambra. He will go and attend stakeholders meeting. Meet the different stakeholders, do the photo ops, and come back to Abuja and stay in a situation room. The foot soldiers are the resident electoral commissioner, the EOs in the 21 local governments, and the presiding officers in the 6,000 polling units that you have in Anambra State. These are the guys who are going to be conducting elections. And you know what happens, Victor? We give these people comfort. They are off the radar in spotlighting. So whether we are looking at election manipulation or good organization of election, they are not in the focus.
because the INEC chairman oversees and ensures they do the right thing. So
they are overseeing. You are overseeing 21 EOs. Okay, you are overseeing a resident electoral commissioner that you did not appoint. You are not understanding this. Who has quasi power? They can call themselves a family, but if you are involved, if you are invested in elections, you understand that this national chairman, okay, will have to walk through minefields. I needed to signpost that. If you understand that, then the second thing that needs to happen, because we are setting agenda for him, I don't know how much time we have. By the time Professor Jega came, Professor Jega did an intervention. That intervention has become a bureaucracy. What was that intervention? He infused academics into the electoral process. Outsourcing the certain aspects of the conduct of elections to these academics. The administration, the INEC administration itself, that you had challenges with in terms of the integrity deficits, not much has been done about that. Do you understand what I'm saying? So those academics now, the politicians have now become very interested in who becomes vice chancellor, in who becomes that process. They have completely ambushed it.
Are you saying it is because of INEC?
Because the guns of that infusion is now facing us. A lot of work needs to happen in strengthening. And let me give you the NAFDAC example. When Akunyili came into NAFDAC, if you remember very well, there were no people came from outside. What happened was motivation for the staff, training, and discipline. And she scored that high point that we saw during her tenure in. So the infusion of the academic, the politicians contribute 90% of the challenges that you have in elections. And Professor Amupiton needs to do well to understand their ability to subvert the process and find out the linkages of this chain that I talked about. If you are talking about election manipulation, where does it happen? Does it happen with the 12 national commissioners? Does it happen in operations department? Does it happen in procurement? Then you come to the resident electoral commissioners. Subnational elections are as good as the resident electoral commissioner. If a resident electoral commissioner is invested in giving credible elections, you will have one. If he or she is not interested in that, you are going to have challenges. You saw it in Adamawa, you saw it in Sokoto, you saw it in Abia in the general elections. So we need to really take time out to understand that it is a whole movement, and that once, let me give you what I'm saying. I've seen a resident electoral commissioner who was giving money to procure vehicles.
By who?
No, procure vehicles for the vendors who will carry materials from one point to the other. Let's say he's told to get 120 vehicles and he gets 50. You're already having logistics, nightmare already. Because what then happens is that the money for the 120, he will find explanation for it. And then you will not be able to move materials from one point to the other. So you are in Abuja saying you have released money. Mm-hmm. Then the money gets to the EO. The EO also decides to bring 30 vehicles instead of 50. This is the Nigerian challenge. So you can sit in Abuja and pontificate the much you want. If those foot soldiers are not aligned to certain kind of values, then you are not going to.
But you just mentioned some resident electoral commissioners who didn't do the needful. For example, the
who
Adamawa.
May not do the needful.
I mean, in the past. I'm talking in the past.
Yes.
Like the Adamawa example you gave. We saw that, I mean, INEC headquarters, or if you like, the INEC chairman at that time, was able to set things right.
He didn't. That's what these interventions, the law was what gave INEC power to now do so. And that was what Dr. Hayatu was talking about. The law, the new law, gives INEC the power to intervene and review. It was not there until Electoral Act 2022. Now, INEC can say, stop. Let us take a review. So those elections were reviewed. The Obingwa, what happened in Obingwa local government was reviewed by INEC. Okay? What happened in Sokoto was reviewed by INEC. What happened in Adamawa was reviewed by the power conferred by the Electoral Act 2022. That power to do, I think it is section 65. Okay? So the point is that the powers, I'm just giving you that election manipulation or good conduct of election is not a one-man business. That's the point that I'm trying to make.
Anyways, but the body language of that one man sometimes can, help those.
What is body language?
Oh well. Well.
That's body language.
Back in this conversation, he's talked a lot about. Well, Yere was making was referring to body language. I don't know how much that could boil a cup of water. But his background as a lawyer, much more a senior advocate, a lecturer, well, we've always had academics, for quite some time. How do these prepare him for the task ahead?
Well, for me, we should pay more attention to his personality as an individual, yes, which encapsulates a lot of things, including character, including his professional, the advantage of his professional calling, as you mentioned, and then many other things. Because if you check the qualities that are required of an INEC chairman to be in place, it's not someone you should doubt about his capacity to perform by the time they are accepted to be in that position. So the expectation is that even if, in fact, that is general for all leadership positions, by the time that the integrity and the quality of that person as a leader is confirmed by everyone in the country, and even including the people he's leading, there are slimmer chances that people could compromise under his leadership. We have seen leaders who have led people that under them have known to be corrupt, but because the leader has integrity and has no tolerance for corruption, they would have to align with his own leadership style, perhaps until he leaves or something. So it is important that he really juxtaposes that capacity to show his ability to be honest in his dealings as an INEC chairman, and also to comply with the provisions of the law. Many people, when they accuse the electoral umpire, they refer to the laws to say that they have violated so section, they have done this, they have done that. And I think it is important and it is high time that these mistakes are not repeated over and over again in a country in which democracy has come to stay. And he must, if you look at, people's reaction on his election, you understand that people have relative confidence that he is of good moral standing to be able to take up that challenge. What remains of him is to put that in practice. And you remember, in all the past INEC chairmen we have had these challenges of questions around, many practices that have happened under the leadership of the INEC chairman that people challenge as violating the electoral laws. Why should we have INEC we have INEC in place? Why should we have, cases after election in court almost being challenged after every election? So the INEC chairman has a duty, and he has mentioned it, that it is not only the INEC chairman that runs INEC. You saw that in some states, like what happened in Kano, during the last election, one electoral commissioner took the decision to do something outside the provisions of the law, and he was allowed to be on his own. It was not the INEC chairman that was accused of that misdoing. And so also all other responsibilities across cadres in the INEC, they are solely for the people who have been appointed to do that job. If they fail, they are responsible for that. So basically, the INEC chairman is more or less like a manager who should be able to really, as he mentioned, oversee and oversight. You are appointed there not to go and impose decisions on people. They have laws guiding their operations.
Talked about character.
Yes.
Ezenwa also made mention of it. He talked about politicians creating 90% of the problems. These same politicians will give you gifts that you don't solicit. Someone told me in private that Professor Jega, part of why it seemed like he succeeded was that he never wanted to interface with politicians on a private level. If it wasn't for, election, those meetings that they will hold with political parties, he never wanted to interface. He never wanted to receive anything. He never wanted to hear that, oh, he's doing something in his village, and they came. He never wanted all of that. And he made it clear to the people who walked around him. Part of the problem that a politically exposed person would have, most likely, is the people around you, the corridors of power, people in the corridors of that power that you hold. If you cannot put a leash on them, they will dent you, because they will take decisions in your name. They will do a lot of things in your name. So how important is that?
No, like I told you in the beginning, the problem in Nigeria is that we see people in the position of power, but we don't know what is in their mind. If an INEC chairman is in place who is supposed to be neutral, apolitical, non-partisan, and is supposed to really manage the affairs of the electoral empire, they have no business with politicians whatsoever. The only business they have with the politicians is when they try to relate with them based on the provisions of the law that yes. But the problem is that we see in all the things that are happening in Nigeria, we see tendencies where when you see elections conducted and you see the responses by some by INEC itself on certain electoral matters, you get to wonder if there is no connivance between such politicians and those people. Okay. So the INEC chairman's integrity is important. If he accepts not to be to compromise, it is easy, just like you mentioned, Jega did it. Although we cannot, what we see is what we can see.
Exactly.
So it is important.
Many thanks, Dr. Hayatu. Let's get back to Chief Izinwagu now, as we begin to round up the conversation, of course. Rebuilding trust and credibility is a major issue. A lot of Nigerians just don't trust the system anymore. They don't believe that credible elections can come out from INEC that we have. What would you expect the new INEC chairman to do in that regard? And then talking about technological advancements, are there improvements you would want to see with him being in power?
First, thank you. Let me say that 70% of the litigation after election are internal party issues. They are not the conduct of the election itself. And we are not paying attention to that. I just wanted to put that out. Most times when you see the court cases, they are not for the conduct of the election. They are either replacement of candidates and all those issues that. So if you have 1,000 cases, you may just find out that it is about 200 that have to do with conduct of elections. That's number one. Number two is the fact that integrity, trust, is not an election issue. Go to the ATM, watch people at the ATM. Nigerians will slot their card, money will come out, they will stand in front of the ATM and still count. So we are really a people, and then election is a divisive issue. Election creates people who are for and against. So you have to always watch out for the voices that you are hearing. Those voices, are they patriotic voices? Are they partisan voices? Before you are able to gauge the... So, Professor Amupiton, what he needs is what Dr. Hayatu talked about. He's a manager. He is managing... See, Professor Amupiton may not go to a politician. A national commissioner may finish commission meeting and go back to return to his patrons. You can't, there's nothing you can do about that now. The nature of our recruitment into sensitive, sacred organizations like INEC are part of its challenges. I've just told you that these national commissioners, resident electoral commissioners, how do they, even Amupiton, the underground of his appointment, the baggages, the debts that are owed around these appointments.
But how can you do it in the above board?
It inflicts.
It goes through the Senate.
It goes that's what I'm telling you. It not only goes through the Senate. It goes through the Council of State. It goes through the secret police, screening you and all of those things. But we have seen all the national commissioners and resident electoral commissioners who currently have been sacked. The Adamawa were all screened. They were all screened. The minister who has resigned now was screened.
So what's the challenge?
So the big challenge is institutional until we become systemic in our thinking, in getting a system that even if you are appointed, you fit into that system by law, not by your whimsical, whether he's a good man or a bad man. We are always assessing in terms of whether he's a good man, he's a bad man.
So some have even said, why does it seem that only academics have the integrity to be in certain positions?
No, that's what I'm saying. Because it's a funny thing. We need to begin to look much more into people fitting into institutions in a way that they cannot maneuver. So my answer to you is that integrity, to show up integrity, is to talk more, to communicate more. Let me give you an instance. Dr. Hayatu said, the ruling party. In 2013, 2014, when the APC was looking for registration, it had not been denied registration, but it came to the media and said that INEC was already a merger with the PDP. Government. By the time it got its registration, it's in 2024, 2025, we have not completed registration. People have already said, INEC have denied us registration. All that put into the public space is what eats into the integrity of institutions. So there are people whose job is to impugn on the nature, integrity of institutions when it does not play their own game. And politicians are adept at that. The same politician who comes to corrupt the INEC official will, if the INEC official refuses, will not go and say, I was refused. He will say he collected from my opponent. That's why he refused. So we have, now 2023, finally for me before, in 2023, this INEC presented Nigeria with the most diverse National Assembly since we came to this democracy, by having, opposition political parties. If you have a Labour Party win election and is in the National Assembly, who conducted that election? If you have NNPP, we win election in Kano, when there's a dominant political party at the top, winning election in Kano, and the election was not stolen, who conducted the election? If the president of the country lost Katsina, his home state, if the president of the country lost Kaduna, where he almost had a cult image, if he lost Abuja, where he works, to opposition political party, you have to be careful in talking about the shifts that are already taking place in terms of competition. Election is a competitive enterprise, and if more opposition parties win election, is an indication of impartiality and neutrality of the manager.
What about technology? Would you want to see?
So technology, 2020 innovations by the Mahmoud Commission. Quiet innovations. Let me give you Anambra, for instance. We are just finishing, we are going into Anambra now. Did you hear of candidate substitution? Did you hear anybody saying we were substituted?
No.
Do you think that happened? It was technology. What the technology? Technology says, conduct your primaries, don't come to Abuja, send us the list of electronically. Once you send it, by 6 p.m. on a particular day, you no longer have access. So Abuja became quiet. It used to be an industry in INEC for the people who are at the gate and the clerks, who were waiting to ensure that those people who will come late, they still will take something from them, open the gate. All that was removed. It's quiet. Nigerians may not have taken interest in noting that what used to be very chaotic and rancorous candidate selection process has been eliminated by just one single action, and many, many more. So what Professor Amupiton needs to do is to also not just look at what has gone wrong. It's important to look at what has gone wrong, but please also look at what progress has been made
and sustain
them, and see how you improve on them and then take an audit of what is not going well and see how
All
we can
right.
improve on it.
Let's take some messages that have come in. This one reads, "Good morning, sirs. My name is British Aharanwa in Lagos." A British in Lagos. I don't believe there will be positive expectations if the electoral reforms are not implemented. That's my candid opinion. Okay. And from Jonathan in Kuje, Abuja, "I hope and pray the new INEC boss should not betray the trust and confidence reposed in him by the citizens. Let him meet the yearnings of the electorate by conducting free, fair, and credible elections across the country. I wish him a hitch-free tour of duty." And finally, from Olaiton Akinwumi in Ekiti, Dr. Olaiton Akinwumi, "I would like to extend my congratulations to Professor Joash Amukpito on his new role. However, I have a question regarding the appointment process for INEC chairman. Given that there are 12 INEC commissioners who have worked alongside the outgoing chairman and have gained valuable experience, why wasn't one of them considered for the position instead of looking outside for a new candidate every 5 years?" Okay.
All right, more questions. I'm sure you just respond together. This one says, "We should give INEC the benefit of the doubt. I pray that God will guide the chairman and grant him the wisdom and courage to do what is right for our nation. Leading Nigeria is never easy. No matter what you do, there will always be criticism. May God strengthen him, help him to stand for truth and justice, and use him as an instrument for free, fair, and credible elections." And that's coming from Muhammad Isa from Kogi State. Another one is from Engineer Akeju Olagbaju. It says, "I watched the screening from the beginning to the end. Yes, he has a good resume, but evaded issues that related to his vision for a new INEC. And did it tell Nigerians how he planned to make INEC truly independent and partisan free." Another one says, "Good morning to you all. Please, the new INEC chairman should try as much as possible to make sure that INEC is truly independent, as the name implies. He should also make sure that he will not be a rubber stamp chairman, and that the technical glitches that happened in 2023 should not happen again. Thank you all, and God bless Nigeria." Richard from Onitsha in Anambra State. I'm sure you want to respond, Doctor, before we get to
Yes, no, I just want to say that, in democratic electoral politics, it's always important to look at antecedents, of whoever is appointed into a position.
Well, just a minute. Do you agree with Ezenwa's point that the trust issue is a Nigerian thing? It's not about how the institution has presented itself in the past.
No, the trust issue is also very, very relevant, because of the Nigerian problem. Because in Nigeria, where there's already all this outcry widely that, corruption everywhere. So you need to give, people the confidence that the person you are bringing on board has some level of integrity, that he can be
It's incorruptible.
Yes. No, not incorruptible, because you cannot determine. The only thing you can do is to say that he's relatively, that's why I use that word, is relatively reliable. By all measures, you want to look at his character, his antecedents, how he has conducted himself in the university. He was a member of committees. How did they do that? They were given assignment and all that. Antecedents.
But can't that change?
Democratic. No, whether it will change or not, it's not, nobody can know. There must be a basis upon which you build your assumption to bring someone on board. That is why, in fact, one of the commentators, just because you didn't ask me a question earlier on about this electoral laws, the Nigerian government is refusing, to pay attention to electoral reform. The Eradua Waste Committee, that report, I saw the report, I saw the white paper, very, very beautiful recommendations, for the improvement of the activities of electoral empire in Nigeria for the purpose of integrity and conducting elections generally. But we are not implementing that. Let me give you an example. I am not happy with the process of selecting an INEC chairman. Because if a sitting president is the one who is going to look around and select.
But who will pick? Somebody has to make the call.
What I'm saying is that in that electoral reform, it will not be the president that will do that.
Ooh.
It is a combination of the judiciary, the members of the Supreme Court, and some other identified within the Nigerian state that are reliable, that are going to, those ones are not for elections, because we do not elect the judge of the Supreme Court.
Those people will come and
naturally
go, and the other new people.
Yes,
new
but
people
the point,
come.
the point is that I don't, because once someone has a responsibility and who has interest in the same election that is coming up, then there is a tendency that that person may be favored.
All right.
So that's why I have serious concern.
Interest can also be by proxy, right?
Yes, Dr. Hayatu, you see, the challenge with us is that the institutions that oversight these appointments, they relict their responsibility. See, if Dr. Hayatu is nominated, the president sends Dr. Hayatu's name to the DSS and say, I want you to check this man out for me. And the DSS comes out with, say, excellent.
Oh, correct.
Or even says
No.
not
good,
not eligible. It's secret. We don't know what that report is. We have to demand transparency in this kind of, what did the secret police say about this nominee? Then he comes to the National Council,
which is
of State. And this National Council of State consists of the people you are talking about, former this, former that, former head of state, former, and they give us unanimous.
No.
Unanimous. And then we go to the place where the real treadmill of scrutiny should happen.
The Senate.
The Senate. And the Senate has committee on intelligence, committee on fraud,
everything.
committee
on we're out of time.
All coming together and saying it's good, even if you take it to NJC, which is the recommendation of Ways. The NJC is not impermeable to the overwhelming pressure from, the appointee that you talk about. The big issue is that those who have responsibility, if the Senate will screen properly, like I said, they screen somebody. The man it is now known that his certificates were not.
So these are the same.
No,
people.
that's what I'm saying. So if the same NJC can screen you, and then you have a problem.
We're out of time.
Many thanks, Ezenwa Wagu,
We're out of
Chairman,
time.
Partners for Electoral Reform and convener Say No
This
Campaign
kind of
Nigeria.
conversation, you give time.
Thank you so much. Yes, I think we may have to reschedule a part 2 of this conversation.
And I want to come back.
There's no time, Doctor. Honestly, there's no time. Thank you so much, Dr. Aminu Hayatu, Department of Political Science, Bayero University, Kano. It was indeed a very interesting conversation, and of course, I hope we have a part 2 of it. Thank you for being our guest, and that's our package on Good Morning Nigeria this Friday. I hope you enjoyed it. Join us on Monday. I'm Ian Ray John, Level Up on the NTA.